Good morning, everyone, and welcome to the first webinar of the 2020 webinar series for the Association for Adult Development and Aging. My name is Janelle Jones, and I serve as co-chair of the Professional Development Committee of the Association for Adult Development and Aging. I'll be moderating today's webinar. Before we begin today, I wanted to inform you all that today's webinar is being recorded. Today's webinar is titled Working with Clients Who Have Experienced Pregnancy Loss, Implications for Mental Health Professionals with Dr. Amber Randolph. As the webinar commences, you may type any questions you have for Dr. Randolph in the comment box and they will be answered at the end of today's webinar. Dr. Amber Randolph is the current president of the Association for Adult Development and Aging. She is the associate professor and chair of clinical mental health counseling at Judson University in Elgin, Illinois. Dr. Randolph's research interests are focused on adult development, women's issues, wellness, and the clinical preparation of counselors. She has been studying, publishing on, and presenting about pregnancy loss for the last 10 years. So with no further ado, I will hand it off to Dr. Amber Randolph.
Hi, everybody. Thank you so much for being here today. I am delighted to be able to share a little bit about what I've been working on for the past 10 years with you all. And I hope you'll forgive me as this is my first webinar. So I'm still learning how to use this technology, which is fantastic and new to me. So today we are going to talk about the impact of pregnancy loss on clients from a human development perspective, why this matters from the developmental framework. We're going to talk a little bit about therapeutic interventions to assist women who've experienced pregnancy loss, and you'll be provided with some resources to share in your own settings that will hopefully be of help to people who are going through this tough experience. So I wanted to start out a little bit about sharing how I became interested in this topic. This is one of those topics that you don't necessarily pick because of just a research interest. It tends to be more of a personal interest. And for me, it was. This is an experience I've had several times. And through my own process of grieving, seeking counseling, feeling better, as a researcher, my mind immediately went to, well, I wonder what's out there. And when I looked, there wasn't at that time very much at all out there about how to help people who have experienced miscarriage, stillbirth, or the general term pregnancy loss. So that got me started researching this topic. And along the way, it's like I opened this door and people were coming out of the woodwork going, well, I've had that experience too. Can I join you in this research? And so we've created this little almost silent club of people who had this life experience that haven't really felt that there's a place for them to talk about it. And some of them are here in the counseling field who've joined me in this research. So it's been a wonderful journey just in learning and growing and having material out there to help other people. So that is a little bit about me and why we are talking about this topic this morning. So just to set the stage from that human development perspective, I'm a lifespan development person. It's my favorite class to teach, and it's something that kind of is in the back of my mind whenever I meet with clients and with students, honestly. But the major category that we'll be talking about today is that early adulthood, so in that 24 to 34-ish range. And you know, as we get into adulthood, it's a little less easily defined and a little more fuzzy with those boundaries of when you enter early adulthood or middle adulthood or even older adulthood. So if we think about this from the perspective of Erikson's psychosocial theory, the crisis that we're tackling during early adulthood is intimacy versus isolation. So this is when we start to partner from more of a long-term perspective, although we certainly can start earlier. And when that learning how to remain centered in yourself while joining with others in close relationships, romantic or otherwise, becomes increasingly important. Isolation is a cause and a consequence of depression, and fear of loss of identity, especially in this stage, can lead to isolation. So situational factors related to grief and loss can also lead to isolation. So along with that, when we think about infertility, which is not the main topic of conversation today, that's a whole other realm. But when we think about pregnancy loss and infertility, this has some pretty enormous impacts on things that are happening of developmental importance during early adulthood. So when we think about what it means to be a woman and what it means to have that role of mother in our lives, it's not something that everybody seeks, but for those who seek, if it doesn't come to fruition, it can be particularly heartbreaking, because not only are you losing the dream of who this person could have been, you're also losing that potential role that you would be fulfilling as part of a relationship with your significant other and with that baby. So the central process of early adulthood is that mutuality among peers. So it's that effort to balance autonomy and connection to others. And as we'll talk about it a little bit, that role loss and the isolation that can come from it can throw off that balance between autonomy and connection. So there's relationship impacts that come along with this type of loss. So we'll talk about those more specifically coming up, but that kind of sets the stage from a developmental perspective. So when we think about pregnancy loss in general, this typically, the statistics vary. It's at least 1 in 5 pregnancies. Some will say 17%. Some will say between 1 in 4 and 1 in 5. Some will say 10 to 20%. So it's kind of all over. I like to say at least 1 in 5. Primarily because those are 2019 statistics and a lot of the other ones are older, but also because we don't know for sure. There are people who miscarry quietly at home and we don't collect that data. There are people who miscarry and don't realize they're doing it. So we know that statistically, approximately 1 in 5 women will experience a pregnancy loss at some point in their adult lives. This can cause psychological distress, and I didn't put the citation there, but it's a study that was done that showed that about half of women were able to grieve and move on with no significant impairment, what we would consider something diagnosable, and about 50% were not. So this can be very distressing for women and their families. We'll talk about themes of silence in our culture, silence in the workplace, silence in the medical profession. We'll talk about the isolation that this can cause, as well as some of the discomforts that can come with engaging with others once this information is shared. So things like insensitive comments, things like diminishing the significance of the loss, and just general discomfort that we tend to have with grief in this society. So just to get us on the same page, some of the terminology here, typically the term miscarriage is used for a loss before 20 weeks gestation. Stillbirth is used after that. Infant loss is used typically if there is a live birth and then the baby dies. All right. So when I became interested in this topic, one of the first things that I wanted to do was to see what was out there. So look at the literature. And I didn't find too much in the counseling realm. I found more in social work and medical social work in particular, and then some in some medical journals. What a couple of my students and I did at that point was we wrote a literature review that's then been published about what we found, the topics, the main themes that we have found in the literature. So those themes to consider are ones of silence, grief, psychological distress, social support, satisfaction with healthcare, and coping strategies. So from those themes, we developed, and we added more people to the team at this point, we developed a survey that we went out and over the course of a couple of years, because this is slow sledding for data collection, because we didn't want to advertise on a listserv or put flyers out. This is a sensitive topic, so we didn't want it to be triggering to people to be invited to participate in our research. So we started with a convenient sample of people that we were affiliated with, not close with, but affiliated with, that we knew would be willing to answer some questions. And from there, we used the snowball method, and we were able to collect data eventually from about 10 women before we reached saturation and started hearing the same things. So over the course of a couple of years, we completed 10 interviews with women who'd experienced pregnancy loss, more than 6 months to a year post-loss to allow some time. And we based our questions on those themes that we had discovered in the literature. So we asked questions about how the silence, about their grief process, about their social support, about their satisfaction with the healthcare they received, about how they coped. So we asked about their relationships with their significant other or partner. And from that, we came to the conclusion, let's see if I can get this, of some overlapping themes, but then some additional ones as well. So the summary of our findings was that it appeared that the medical interventions and just interactions with the medical community was something of noteworthy. That social relationships were incredibly important. So these are things that were echoed in the literature. That the emotional component of this type of loss needed to be attended to more than it has been, that the meaning-making process is also important. So having a place, and I think this is where counselors can be very helpful, having a place to go to process through and try to make meaning of this seemingly meaningless situation. And finally, all of our participants were very excited to share what they think would have been helpful or what was helpful to them in getting through a very tough time. There was a strong advocacy theme running through our interviews, where once we got these women talking, and it was a semi-structured interview, so we had our questions, but then we let it go. All of these interviews were recorded. They were transcribed by a professional transcriber, and we were able to work with the data from there. But all of these women, once we got them talking, were very excited that we were going to be out there sharing this information with others. So hopefully others can have I don't want to say a better experience than they did, but maybe a slightly less painful one. So we will talk through some of these additional themes. All right. Before we focus more on what the participants had said, I did want to frame the bereavement and grief conversation a little bit, just to make sure that we're all on the same page. So loss is an encompassing theme in our life, not just death, of course, but all different types of loss. I would argue that a lot of what we do as counselors is grief counseling in some way, shape, or form. But we'll think about this a little bit more. So the idea of loss, that real or perceived deprivation of something that we deemed meaningful. So we can't feel loss unless we deemed something meaningful. Grief is that personal or interpersonal experience of loss. It can include sorrow and distress. So loss is when something that we deem meaningful is deprived from it. Grief is how we experience that. Mourning is that outward expression of grief. So it's what you see. It's the crying. It's the behavioral things that we do. Loss adaptation is that process that we go through of adjusting to our loss and our grief. And I feel like this is kind of, this came from Karen Humphrey's work. She has a fabulous book out there. In fact, I carry it with me often. It's right here, actually. And it's in the reference page as well. But she wrote a fantastic book on counseling strategies for grief and loss. But the idea of loss adaptation, I feel like, is an empowering way to frame this, where you go through a process. You're active in this process. It's not just something that happens to you, but you're active in this process of adjusting to your loss, to your grief. And finally, bereavement is that period of sorrow following a death. So all losses, all grief, all grievers are not the same. So we'll talk today about strategies, knowing that they're not going to work for everybody. Not everybody has that same constellation of do this and they'll feel better. It doesn't work that way. But hopefully we can take some of these strategies and at least be helpful to some clients. So some more about conceptualizing loss and grief. So loss is unique. We grieve like ourselves. From a constructivist standpoint, I love this. Everybody has their own reality. We grieve like ourselves. There's no universal strategy for this. Loss is contextual. It doesn't occur in a vacuum. Everybody's situation is different based on their circumstances, their environment, the people that they're surrounded with, their own personal feelings, their worldview, all of those things. Loss is nonlinear. Grieving is dynamic. You cycle through stages. Sometimes it's one step forward and 2 steps back. Loss is connective. It doesn't demand disconnection. And this kind of gets into a spiritual realm that I'm only going to touch on about this far, but it's not necessarily a disconnection from the person. It maybe is redefining or altering the bonds that you had with them. Loss is normal. It's something that we all go through. It's not abnormal and it's not dysfunctional. Sometimes we try to focus on making people better as soon as possible, and that implies that their grief is dysfunctional. Maybe some of the side effects of it can be dysfunctional, but grief itself is part of life. Loss is part of life. Grief is active. It's not necessarily a series of stages that are outside of our control. Clients are equipped to deal with the challenges of grieving. We all have it in us, and I think that's where that adaptation piece comes in, where it can be very empowering to think that you can, this isn't just something that happened to you. It's something that you can be active in your own healing. Loss is meaningful. We can create meaning from our losses. Some losses fit into our belief structures, some don't. As painful as it is, and I've been there, losing a grandparent is painful and it makes sense. Losing a child doesn't make sense, right? That's not the order that this is supposed to go in. So some losses fit into our belief structures as what makes sense, and some don't. Loss is transformative. Grief never ends. It changes, but never ends. The intensity moderates, right? It's not as painful physically and emotionally. And it becomes a part of you. There's integration. So you adapt as a human to your loss. All right, so some of those common reactions to grief that you might see clients reporting. or you might have experienced yourself. So grief happens in all of these different realms: the physical realm, behavioral realm, the intellectual realm, the emotional realm, and the spiritual realm. Now look at these symptoms here, these reactions to grief, and you can see where it can be sort of difficult to sort out what might be something else in the DSM. So sorting out bereavement, depression, anxiety, substance use disorders, other things. And we're not going to get into the diagnosis piece of this today, but that is something that's worth looking into, what's in the DSM as far as bereavement. All right. So when we spoke with our participants about their grief, they talked about a roller coaster of emotions. So we again think this is not linear. This is something that there are good days, there are bad days, there are steps forward in your grieving process, there are steps backwards. There are particularly tough seasons, holidays, anniversaries, things like that, that set us back. So it's been a roller coaster. We heard that more than once. When people initially experienced their loss, there was disbelief and confusion. This, again, goes back to the meaning making. This doesn't make sense. How did this happen? I can't believe this happened. What tended to follow was numbness and disconnection. Kind of that checking out, when things get painful, sometimes we do that. And then depression. And one person said it was like black. So it can be very, very painful. People felt pathetic and isolated, like no one understood. People had envy. People talked a lot about, coworkers who were also pregnant, or having to respond to baby shower invitations, or, reading about, somebody on Facebook just had their baby, things like that. So that envy component of it, it is not fair, and it's not fair. And minimization is something that we heard a lot about. I mean, women are tough. Kind of society doesn't really see this as being something that's a huge deal, and so I'm just gonna get up and go to work anyways. This leads into the social component of this, but all of these things were people's experiences of grief. So that theme of silence comes up often. In our workplace cultures, in our culture in general, it's getting better. I will say that it is getting better, but there's still not so much of a place held for this type of loss and grief in our society. So as a culture overall, we don't do a fantastic job of building structure and ceremony and ritual around pregnancy loss. In the workplace, this can lead to not only awkward or uncomfortable encounters with colleagues who don't know what to say, who don't know how to express condolences, but also some medical leave or time away sorts of implications. So this is not something that there's really a great script for in our culture, so our workplaces follow suit. In childbirth classes and books, if pregnancy loss is mentioned, and in the books they're getting better, I will say, it's maybe a chapter or a part of a chapter at the end. So not so much of a focus on this happens to 1 in 5 women. So there's no proactive approach to let's talk about this possibility. And some of that is it's hard for us to talk about, what if things don't work out? And for some, it's that they don't want to hear it, that something could go wrong. Even our medical terminology, the medical term for miscarriage is a spontaneous abortion. And in our research, we talked with women who said, I saw that on my medical record and I just about fell over. I didn't abort my baby. And it was very hard for some people. There was one participant who said, now my doctor told me that this is what's going to be put on the medical record because that's what they call this formally. However, the doctor was kind and explained that they realized that this is very sensitive and tough to hear and tough to read, especially when you start getting bills and insurance paperwork and things like that. So even our medical terminology can be somewhat cold, and that was discussed by the participants as well. As far as isolation is concerned, some people spoke about the almost need to keep this a secret, especially if they weren't terribly far along. There's some people kind of subscribe to the don't tell anybody about a pregnancy until you're 12 weeks along. And if a loss happens earlier, people may not know. And some of that can lead to isolation. So, there are varying reasons why people tell, who they tell, when they tell, but by not saying anything sooner, people can set themselves up for feeling isolated because nobody knew. And there's this drastic loss in their life and nobody knew. Some of the themes of silence and the social implications can also spill over into partner relationships, partner issues. So some partners were distant, and just for our research, we didn't plan it that way, but all of the partners of the women that we interviewed were males. We would love a bigger sample someday, but it took us years to get 10. So we kind of stopped it there, but we would love to do some future implications on same-sex couples as well. But for this research, it was male partners who were either distant, supportive, or just flat out missing. So the distant ones, the women reported that they were frustrated and hurt that he wasn't acting more concerned. Or, there were some that acknowledged that maybe he was in a state of disbelief too. And one person said he just kept saying, you're fine. And, she wasn't. So there's the distant partners, there's the supportive partners that were kind of right there along with their partner during this grief journey. And then there were participants that didn't mention their partners, even if they were spouses. So that was curious as well, something that we noticed, but didn't call attention to. We were just kind of collecting this information, and something that we noticed later, like, wait a minute, they didn't mention their spouse or their partner at all. All right, so some of the healthcare implications were particularly interesting, and something that I think could lead to further research down the road. This is definitely an area where I think that there could be the opportunity to be really helpful for people in general, in the counseling field and the medical field. But the interactions with staff were of particular note. So the doctor is often your first point of contact for a pregnancy, and then in the case of loss as well. So doctors hold a lot of power here, and we found in our research that some doctors handle that very well and some did not. And when it was not handled well by medical staff, it was very, very negatively impactful for our participants. So people provided several examples, but I think the overarching theme was this may be typical for doctors, for OBGYNs, it's not typical for the person who's experiencing that. So even though often, not always, but often miscarriage is not medically dangerous, it's still a really big deal. And there were multiple participants who felt very minimized by their experience. So acknowledging the emotional impact, not just the medical impact, which again, it's not necessarily dangerous. It does happen to at least 1 in 5 women. This is not uncommon and it's not dangerous, so it can be minimized. But acknowledging the emotional impact of it is of key importance. Again, some of the medical terminology is incredibly insensitive, things like the spontaneous abortion, even some of the words for procedures used afterwards to make sure that the uterus is clear is not terribly friendly language. So the insensitive language part, the insensitive process part. So women talked a lot about miscarrying or having their stillbirth happen in a hospital on the labor and delivery floor where they can hear babies crying. Having their 6-week follow-up appointment at their OB's office, surrounded by pregnant women or women with babies. So the insensitive process is also something that can be incredibly painful for participants. The lack of follow-up and resources was noted with the medical profession. Often people were dismissed because this is not necessarily medically dangerous with okay, well, there you go. Perhaps they are led toward some support groups, and a lot of the medical systems offer at least monthly support groups. So perhaps they're told about that, but often they're sent off with no resources whatsoever. And as one person put it so well, how do I know what I need? So resources, advocacy and resources were incredibly important. One person commented that their physician did follow up with them personally to check in and see how they were doing, and mentioned how much that meant. But for most everyone else, as long as they were cleared medically, there was no follow-up. Very few resources provided and no follow-up to this. So all of that leads to what these participants would say is, what was and would have been helpful. And this is where people really started to get excited. So they talked about the need for medical and emotional care. They talked about the need for early discussion of the loss at the hospital. They talked about additional training, more like sensitivity training for medical professionals to help them understand the emotional and psychological impact of pregnancy loss on women and their families. They talked about resources and the need for follow-up, helping people understand their choices, who to tell, how to deal with going back to work. And then not just medical follow-up, but emotional follow-up as well. I think one of the biggest themes was the need for acknowledgement and validation. And that's something that as counselors, we are well placed to provide. And a connection with others. A place to connect with others. So some sort of community. There were other people who had commented, it was my experience too personally, when I started talking about this, other people would say, hey, that happened to me too. And there's almost this sense of community that is created. And now with social networking, there's opportunity to participate in those ways as well. And this extends into the next pregnancy, if there is one. For our participants, they mentioned feeling terrified. That was a word that was used. that they were in a constant state of anxiety, that they were in a state of disbelief where they didn't believe that it would be okay. They had some advice for people like, don't take it for granted. Every day of this is one day closer to hopefully a successful outcome. Our participants reported increased empathy for others, the desire to advocate for others. And again, this is where we saw people start to get really excited about what we were talking about and the fact that we were going to be presenting on this and publishing on this and getting the word out to other people as well. There was also a sense of gratitude for having a successful pregnancy for those who were able to do that. So all of this, that connection with others, that community building, the bringing light to this topic were all things that our participants talked about as being very helpful. Another thing they talked about was making meaning, trying to make meaning of this situation. So starting to question themselves, did I do something wrong? Was it me? When they were dealing with infertility, as some of them did prior to their pregnancy loss. And honestly, that the word infertility encompasses pregnancy loss as well, because it's not only the inability to get pregnant, but the inability to carry a pregnancy to a successful conclusion. But people would ask questions like, how long is this going to go on? Where they felt like they had no power over their own body and could just, for some, faith came into this where they would hope and pray that it would be okay. There was that feeling of injustice. I didn't do anything wrong. I don't deserve this. And a deep search for meaning. So this happened. How do I make sense of this in order to move on and move forward? All right. Okay, so some of those strategies for counselors, acknowledging that grief is complex and individual. So everything on this slide, this is not rocket science, right? But it's something that maybe it's a good reminder for all of us to step back and to place ourselves again firmly in our client's shoes. So grief being complex and individual, let people tell and retell again their stories. This provides multiple purposes. It helps people to express emotion. It helps people to connect with others. You might be the only safe person in their life that they can talk about this with. Everybody else gets really uncomfortable and awkward. It helps people gather and organize information and consolidate it, and it helps people problem solve. So acknowledging that that's a complex and individual process. Your job is to listen and acknowledge. And counselors are very good at that. You might be the only person they feel comfortable sharing this vulnerability with. So it's important that you're able to be open about death. For that, it's important to be able to face your own mortality, which is not always an easy thing, right? But coming from a place of being able to do those things will allow you to validate and normalize feelings. Also be ready to discuss religion, spirituality, the purpose of life, the purpose of death. All of those very existential things tend to come up as people are working through this grieving process. Screen for depression and anxiety, as we know that about 50% of women will have some psychological distress following this type of loss. So making sure that you're screening for depression and anxiety and trying to sort that out from what gets kind of fuzzy with bereavement. Assess and focus on holistic wellness. Anything that you can do to kind of help provide some information or resources in those areas. I think something that can be really important and isn't widely done everywhere is incorporating fertility information into your intake forms. It's something that can be as simple as one question or more thorough, but at least, especially if you know that you are working with a woman or perhaps a partner of a woman who is in that kind of childbearing age range, it's important to ask, because maybe you're the only one who ever has. That emotional psychoeducation, part of that is that validating and normalizing feelings, but some of that is the education about feelings and about expressing feelings. You know, we know that not every client comes in well versed in emotions rather than the major ones. You know, it's okay to feel things other than sadness at this time. It's okay to be angry. It's okay to be, list the other multitude of emotions you could be feeling all at the same time. The importance of wellness is not to be discounted here. Even things like being out in nature, yoga, reconnecting with your body, perhaps massage, some creative activities, expressive sorts of things, mindfulness, all of that, making sure that you're paying attention to wellness in the various aspects of life, including the spiritual realm. So spiritual strategies can be resources if that's appropriate for your client in the cognitive, behavioral, and affective realms. This can help with that meaning reconstruction. So kind of revising their beliefs about themselves and others. Some of those roles, if you go back to the developmental slide, some of those roles that we're supposed to play at these ages, and trying to reconstruct meaning in a different way. Helping people connect to social support in those various realms of life. So the partner relationship, if there is one, relationships with other children, because that's a whole other presentation. As a family unit, things are impacted when there is a pregnancy loss. So connecting with the partner, if there is one, connecting with other children, in their work community, their friendship community, extended family, if there's a faith community or a volunteer community. So all the other social relationships that they have. And some of the resources that I'll share can be a source of social support or community for people. Additionally, providing advocacy and resources. So helping people to connect to some resources that might make this process easier. Helping people advocate for themselves with their healthcare professionals. That could be as simple as just working with your client in session. It could be as broad as going out and talking to medical professionals if you find that a good deal of your caseload is experiencing these type of issues, to maybe do some training or advocacy work, getting out there. That's a possibility as well. Also, I don't have it on this slide, but I want to highlight the importance of knowing yourself as well. So this is a pretty personal topic that if you're working with adults, you'll encounter very likely at some point. So knowing how you feel about the topic of pregnancy loss, miscarriage, maybe infertility in general, this can be really triggering to people depending on your personal situation. So knowing that about yourself. When you're dealing with somebody who is working through grief, things that you can do to take care of yourself include moving often, taking care of your physical health, making sure that you're continuing to breathe deeply, journaling, maybe engaging in some sort of other creative expression, seeking spiritual assistance if you need to come to terms with your own mortality and your own point of view about death. Otherwise, talking to people that you trust about your needs, consulting professionally or talking with trusted friends or family, and making sure to keep regular appointments with the people who help keep you healthy. So your personal maintenance. Now, whether that's, you know, on the physical realm with physicians, on the psychological realm with your own counseling, other types of personal maintenance. All right, I'm going to share just a couple of resources here. The Share Pregnancy and Infant Loss Support provides information, resources, grief support for pregnancy, loss, and stillbirth, or infant death. They do offer newsletters and chat and message boards. The October 15th is the National Pregnancy Loss Day. So the october15th.com website, Remembering Our Babies, offers additional resources too. And then Resolve is the National Infertility Association. So that has broader information and a ton of resources. There's other message boards, information available online, different social media groups. So there are different ways to get connected and involved. And within your own communities in your own areas, if you check with your local healthcare systems, there's typically, again, at a minimum, usually a support group and resources. Depending, it's actually very good around where I live, but where I used to live, it was not. So I think it varies widely depending on where you are. But that's, again, something where if you're seeing a need in your community, perhaps that's an advocacy piece if this is an area of interest for you. And if there's any way that I can help in any manner to facilitate that, I'm happy to. I think that leads me to the question part of this, and there's actually a few minutes more than I'd planned. So if anybody has questions, feel free to type them in, and Janelle can help me facilitate that.
Yes, so everyone, again, as Dr. Randolph said, you can go ahead and type in your questions in the Zoom group chat if you have any. I've had a few people message me privately and send in questions, and so I will go ahead and read those off. Firstly, the first question I received was, what tips would you have in working with clients that are grieving the loss of their partner's pregnancy? That is to say that while they may not have never carried the child, they experience a loss as well.
For sure. So this is something that with our research, we focused on the women. Future implications, we're going back to the partners. But I would say that it's much of the same as I shared on this slide. So recognizing, of course, that grief is individual and complex. Just because somebody didn't carry the baby physically doesn't mean that it wasn't just as much a hope, a dream, a goal, a human for them. So listening and acknowledging, validating their feelings, validating their right to have those feelings, whatever those feelings are. Screening for depression and anxiety. Again, this gets a little fuzzy. Providing some psychoeducation, even just especially if the physical health care wasn't fantastic as far as providing information about what actually happened, perhaps providing some of that, even if you could point them toward different resources. I mean, you don't have to put on your medical professional hat, but being able to at least connect the partner with resources to understand what happened to the woman's body during this. Psychoeducation regarding what he or she may be going through. That focus on wellness, the need for social support. I have not seen a men's group for this or a partners group for this, even to broaden it out. I think that that's something that could be very helpful. I think that especially if you see a need in your community, that could be something that's very useful if you can get people to attend it. But providing some sort of resources toward a social network would probably be helpful. Again, especially if you are just dealing with the partner and not in a couples counseling situation, encouraging communication and mutual support. This is acknowledging that people grieve differently, but having them work to stay connected as they both are going through their grieving process.
Okay, wonderful. So a second question that was asked was, how do we as counselors advocate for the improved education of doctors or medical professionals on bedside manner or implementing compassion when working with individuals that have experienced a pregnancy loss?
That is a great question. We are trying to figure that out right now. It's a hard system to get into, especially if you don't have the letters MD behind your name. So what we're doing is our research team is taking more of a grassroots approach and leveraging some personal and professional connections in our community to get a foot in the door. And once we have a foot in the door, we can provide resources and education. We're looking into different conferences that medical professionals would attend. Frankly, we're having more luck with nurses, but it's a need that we see. And I think partnering with medical professionals and even behavioral health professionals, because I have some now grads, former interns who are in behavioral health, and kind of using them to help get us in. I think that, working more of grassroots in your community, sort of forging those personal relationships will get you further. That's been our experience. Although we'd love to see this, go national. We'd love to have education for physicians and nursing staff on a national level, but we're just not having much luck.
Thank you for that. So our next question is, what are the professional certifications useful to gain further training when working as a counselor with fertility and pregnancy loss?
That is a very good question. I had contemplated, there's a certificate in thanatology, which is the study of death, that perhaps it's something that I'm considering that might be helpful. I know that there's the grief recovery program that could be useful. There's really not anything specific to dealing with infertility and pregnancy loss. There's trainings, of course. PESI and other places do a ton of different trainings, but I've not found anything that's, certificate-wise based solely on this. I think that it could be really useful. And maybe that's a future direction. So if that's something that's interesting and you want to help me figure out how to do this, I'd sure love it.
Okay. One other question is there a rule of thumb or a timeline that you would recommend for clients joining virtual support communities? Social media can be helpful, but also very triggering.
Yes, for sure. It's different for everyone. One thing that we have learned is that even in live support groups, trying to match people that are at a similar stage is helpful. Because if you have people who are, a year out and they're starting to, not, I don't know how to phrase it, not move on, but it's less fresh, that physically reactive kind of triggering painful and more processed, contemplated, consolidated, and you have somebody who's fresh in their loss, it can be really hard to manage them both in a group. And for unmoderated, just peer support groups, it can get dangerous. So this is me as a human speaking and not necessarily me as like a researcher speaking, but if it were my client, I would want them to be very careful. I would never tell somebody what to do or not do, but I would want them to be very careful who they share their grief with while it's still that fresh. I think support groups can be helpful, but as you pointed out, they can also be very hurtful. And if there isn't anybody moderating it with any sort of experience with this, professionally experience with this, there's the potential for some damage to be done, and I wouldn't recommend that. I think that's one where I'd want to have that person cultivate a safer support circle, if at all possible, at least as their base. And then if they choose to wade into those waters, they could, if that helps.
So we have one final question.
Yeah.
As a counselor, do you ever recommend women working with a doula to help with the advocacy aspect of a potential loss?
Yeah, absolutely. I think that doulas can be great advocates and can be supportive as long as there's a healthy relationship between the doula and the family, which I mean, I guess I've heard stories of not anecdotally, but for the most part, yes, that seems to be a good move. But yeah, that's absolutely somebody who can be in your corner 100%, working for you and your family and advocating, especially from the healthcare perspective, to make sure that you are treated in a manner that is helpful in what is a very challenging situation.
Wonderful. Well, thank you again, Dr. Randolph, for that wonderful and interactive presentation. Thank you, everyone, for attending today's webinar. Just a couple of notes. Within a few days of the webinar, you will receive an evaluation link that should be completed, and then you will receive your CE certificates via email, along with the presentation materials from today's webinar. Next month's webinar will be on February 25th at 1 p.m. Eastern Time with Dr. Matthew Bowen, who will be presenting Medicare reimbursement for counselors, advocacy updates, and policy implications. Also, we are pleased to announce the Association for Adult Development and Aging 2020 National Conference. This year's theme is At the Intersections: Equity, Advocacy, and Activism Across the Lifespan. The conference will be held August 6th through the 8th at the Charlotte Marriott City Center in Charlotte, North Carolina. Please be on the lookout for AADA emails to receive further details, including the call for conference proposals. We hope to see you all there. Thank you all again for attending today's webinar, and have a wonderful rest of your day.
All right. Oh, thank you. I'm just starting to see the messages. Thank you all. This was wonderful. Let me know maybe in your evaluation if you want to connect after this, if this is an area of interest.